Sometimes we're faced with patients who have very localized areas of neuropathic pain or nerve pain. This can be caused for a variety of reasons, but essentially they have damage or dysfunction to an element of the nervous system and they get local hypersensitivity and pain. Now, the mainstay of treatment for any kind of neuropathic or nerve pain tends to be medication, and that tends to be taken orally by mouth, or there are some topical preparations, patches and that sort of thing. There are a variety of other treatment options, but from time to time we opt to use small injections of Botox. This is Botox preparation. Botox is generally known of in its use in cosmetic practice, where it's used to reduce wrinkles, for example. However, one of its other major uses, or major uses, are in muscle relaxation. So if patients have a lot of muscle spasm, we use it, but also if patients have very discrete local areas of nerve pain or neuropathic pain, this can be an extremely simple but effective treatment option. You would bring the patient in as a day case and assess the area where the neuropathic pain is. We then clean up the area with some antiseptic, and essentially we would mark out a little grid. We circle around where the area is, mark out a little grid about 1 centimetre to 1.5 centimetres between the points, and we use very, very tiny needles. I actually use cosmetic needles. These are 23 gauge needles because the area is often very uncomfortable, and literally just under the skin I will inject some tiny amounts of Botox mixed up with local anaesthetic, fast-acting local anaesthetic, to make it as minimally discomforting as possible. The way in which the Botox works is actually quite complicated, but in simple terms, the Botox is thought to be transported into the local nerves, also back to the spinal cord, and essentially the Botox can have an inhibitory effect for patients who have neuropathic pain or nerve pain. As with all procedures, there are risks and benefits. The benefit is pain relief. It takes about 10 to 14 days to work, sometimes less, sometimes more. The risks: failure, local bleeding, bruising, infection, discomfort, which are all fairly minimal. Overall, the use of local injections of Botox can be extremely effective in certain patients, and is certainly worth considering as a minimally invasive pain management procedure.